come to the podium.
Thank you. I'm Will Pitts, Chairman of the Republican Liberty Caucus of Florida, and just want to, a pretty large number of our members came here today from around the state in strong support of this bill, and we just want to express that support and waive any further comment. Thank you.
All right. Alan Douglas, National Federation of Independent Business.
Thank you, Mr. Chairman. I'll be very brief. Obviously, with what happened yesterday, you can imagine that as a group that represents small businesses, we received a number of phone calls this morning. And I'd just like to say that our members are very angry and they're very scared. And I think what this bill does is it shows to them that this legislature is willing to do everything that it can to protect their rights and then give the citizens of Florida the chance to vote to send that message to Washington that Floridians are not happy with what's happening.
Thank you. Stephen Wynn, Florida Osteopathic Medical Association.
Waive our time and support, Mr. Chair.
Jeff Scott, Florida Medical Association.
Waive and support.
Richard Palangan, Florida Public Interest Research Group. And if I get any of these wrong, I apologize ahead of time. I'm trying to read the writing.
Thank you, Mr. Chairman and members of the committee. I'm Richard Palangan. I represent the Florida Public Interest Research Group. We're known as Florida PIRG. I am here today to urge you to vote no on this bill. In the years to come, as the new historic national healthcare reform legislation is fully implemented, the legislation will begin to lower costs by delivering better, smarter care and by increasing competition in the insurance markets. The result will be a $1.4 trillion smaller deficit over the next 2 decades. Consumers purchasing their own insurance will find 14 to 20% lower premiums for the same coverage than without this legislation, and that's according to the CBO. Insurers will be prohibited from using pre-existing conditions, errors on forms, and lifetimes or yearly caps to drop coverage or price it out of reach. In Florida, approximately 4 million uninsured persons will have access to affordable coverage. Instead of going to costly emergency rooms and hospitals, people will be able to obtain care early in their illnesses in appropriate health care settings. Florida will have a healthier and thus more productive population, and the well-being of the majority of our citizens will be enhanced. We would urge the legislature to begin to plan for the Medicaid expansion and for the state health insurance exchanges that are contained in this historic legislation. Thank you.
Rich, you have a question? I'm sorry.
Yes, sir.
All right. You're recognized.
My question for you, sir, you mentioned a $1.2 billion lowering of the deficit. Can you personally guarantee that?
You're recognized.
As I understand, that's a CBO number.
Well, I personally am sick and tired of hearing about CBO numbers. Thank you, Mr. Chairman.
We'll save our debate for debate. Thank you.
Thank you.
All right.